Welcome to the Explainer. Today, we are going to tackle a big one, Medicare. If you're getting close to 65, your healthcare is about to change in a major way, and we're here to break down the most important choices you're going to have to make, step by step.
So, if that 65th birthday is on the horizon, you're about to step into the world of Medicare. Now, I know it can feel super complex, but don't you worry. We're going to give you a nice, clear map to help you navigate all your options.
All right, let's get right into it. We've got to start with the foundation, right? The part that applies to pretty much everyone, and that is Original Medicare. So what is Original Medicare? Well, think of it as your baseline coverage. It comes straight from the federal government. This isn't some private plan. It's the core program, and it's broken down into two main pieces.
The easiest way to think about this is Part A, that's your in-the-hospital insurance. You know, for those bigger medical events that mean you have to stay in a facility. Part B, on the other hand, covers pretty much everything else. All your day-to-day stuff like doctor's visits, lab work, and outpatient care. Okay, now this is where things get really, really important. While Original Medicare is a fantastic starting point, it is not a blank check, not even close. You are still on the hook for a pretty big chunk of your healthcare costs. I love this analogy because it makes it so clear. Imagine Original Medicare is a slice of Swiss cheese. Yeah, it provides a lot of great coverage, but you can't ignore the fact that there are some pretty big holes in it. And anything that falls through those holes, well, that's on you. So what are these holes we're talking about? Well, you're looking at things like deductibles, which you have to pay first, and then coinsurance, which is your share of the bill. And pay special attention to that 20% for most services because, and this is the kicker, there is no annual cap on that. It's unlimited. Plus, huge things like most prescriptions, dental, and vision, yeah, not covered at all. Okay, so you see the holes. How in the world do you protect yourself from those potentially massive, unpredictable costs? Well, that leads us right into one of the most popular solutions out there, Medigap plans. Medigap, or as you'll sometimes hear it called, Medicare Supplement, does, well, exactly what the name says. It's an extra insurance policy you buy from a private company. Its whole job is to fill in those gaps left by Original Medicare. Basically, after Medicare pays its share, your Medigap plan comes in and helps pay the rest. Now here's something that makes life so much easier. The government standardized these plans. What does that mean for you? It means a Plan G from one company has the exact same core benefits as a Plan G from any other company. The only difference is what they charge you and their customer service. Yeah, people talk about the alphabet soup of all these plans, and it can be confusing. But you can really just group them into three main buckets. You've got your basic core coverage, then you have your really comprehensive plans like the super popular Plan G. And then there are cost-sharing options, which have a lower monthly premium, but you pay a bit more when you actually use your insurance. But wait, Medigap isn't your only choice. There's a totally different path you can take, and it works in a completely different way. It's called Medicare Advantage. Okay, this is probably the most important distinction we're going to make today. Medigap works with Original Medicare. It adds to it. Medicare Advantage, which is also called Part C, actually replaces it. You get all your benefits from a private company, usually in an all-in-one plan that has a network of doctors. The upside is often lower premiums and bundled drug coverage, plus a cap on your yearly spending. And just two more really important things to keep on your radar. First, prescription drugs. You're going to need a Part D plan for that. And second, this is a big one, long-term custodial care, help with daily living activities, is not covered by any part of Medicare. That's a completely separate ballgame. All right, everybody lean in for this part. I am not exaggerating when I say this might be the single most important, time-sensitive thing we talk about today, especially if you think a Medigap plan is right for you. This right here, this is your golden ticket. It is a one-time only 6-month period. During these 6 months, federal law guarantees you the right to buy any Medigap plan you want. The insurance company can't ask you about your health. They literally have to sell you a plan. That's it, 6 months. Because once that window slams shut, the rules of the game change completely, and you may never get those rights back. And this slide lays it all out, plain and simple. During that window, you're in the driver's seat. Your acceptance is guaranteed. But once you're outside that window, whoa, all bets are off. Insurers can dig into your entire medical history and can charge you way more, or they can just flat out deny you coverage, maybe for the rest of your life. Whew, okay, that was a lot of information, I know. So let's bring it all back together and map out what this decision-making process actually looks like for you.
So here's your roadmap. Step 1, you start with your foundation, which is Medicare Parts A and B. Step 2, you have to understand those gaps we talked about. Step 3, you choose your path. Stick with original Medicare and add a Medigap plan, or go with a Medicare Advantage plan. Step 4, don't forget the drugs. But the one you absolutely cannot miss is Step 5. Use that one-time enrollment window. It is so important.
Look, at the end of the day, original Medicare is just the starting line. The real decision, the choice that will shape your healthcare for years to come, is how you choose to build on top of that foundation. And just understanding these options, that's the first and honestly the most powerful step you can take toward a secure and confident future for your health.